My name is Tabitha, and I'm an admissions representative on behalf of George Mason University for the online Masters of Public Health program. And I'm here as a resource to give information and answer questions and help walk you through the admission application process. But tonight, the star of the show is, we have our directors and we have, some special guests with us. So they're going to go over some things for us. So I was going to share a quick overview of what we're going to go over this evening. We are super excited to be joined with our director, and they're going to start telling us a little bit about themselves and their roles, touch a bit on the program, career outcomes, and kind of how the online format works. And at the end, we have time for question and answers, which is always one of my favorite parts because I learn a lot too. And let's see how to participate. So before we jump in, just a little bit of housekeeping. At the bottom of your screen, if you're on a desktop or a laptop, or it should be a question and answer box, or if you're on mobile, it should be somewhere around your screen there. It says Q&A. Feel free to put your questions in that question and answer box, and we will answer those. We're going to try to save the questions to the end. Sometimes I know if it's something that our presenters are talking about, they will go ahead and touch on it and we can answer it live right at that moment. But feel free to put them in there and we will answer them, as before the end of the night. So also there is a chat box that you're welcome to type in there if you just had something specific. But if you could use the question and answer box for your questions, that would be super helpful. And without further ado, we're going to introduce some of our special guests. We have Dr. Mitchum, Director of the MPH program, and Sarah Liu, the MPH Coordinator. And then we also have another special guest with us, and I'm going to let Chris introduce himself after Dr. Mitchum and Sarah, if that's okay. So, Dr. Mitchum, if you could take it away.
Hi, welcome everyone. Thank you so much for taking the time to meet with us. As Tabitha said, I know your time is precious, so I appreciate you prioritizing spending this time with us this evening or afternoon, depending on where you live. I'm Dr. Mitchum. I'm an assistant professor in the Department of Global and Community Health, College of Public Health at George Mason University. And I'm also the director of the online MPH program, which means that if you have the wonderful choice to join this program, you'll also see me in a lot of your courses as your faculty member. So welcome.
Hi everyone, my name is Sarah Liu. I'm the MPH Program Coordinator. Thank you so much for being here today. It's nice to meet everyone. I am also the academic advisor to all master level students, so certificate, the MPH program, as well as a Master Science in Global Health. So if and when you do come in as a PHP student, I will also be your academic advisor as well. Nice to meet you all.
Hello, everyone. Hello, everyone. Welcome. Excited to be with you all today. My name is Chris Williams. I'm the Associate Director for Graduate Recruitment and Admissions for the College of Public Health. So a great resource for any questions that you have admissions related as you're considering applying to the program. I'm happy to answer any questions that are related to the admissions process.
Thank you so much. I'm going to move to the next slide for us here and let y'all take it away. Where this is one of my favorite times is just to get to hear more about the program, and I know our guests are waiting as well.
All right, I will take this off. So again, I'm Dr. Mitchum. Thank you so much for joining us tonight. And I wanted to start off by sharing a little bit about why our program is a bit unique. So there are a number of reasons why I strongly recommend you consider George Mason University. First and foremost, and this isn't on the slide, I am one of many people who was trying to balance work responsibilities, family responsibilities. I didn't live close to the institution that I decided to pursue. So I actually completed my MPH degree completely in an online format. So that experience, the good, the bad, and ugly of all of that, made it so that I wanted to be involved in designing a program, leveraging the amazing faculty that we have at Mason, but making it engaging and tangible so that the learning experience will help you be successful in the field. So everything that you're going to hear about tonight, any questions that you have about the program, please do know that this program has been designed with that intent to not only be engaging throughout the learning process, but then also help so that there's that transfer of knowledge that you learn in the program and in the classrooms, but then also practicality of how that applies in your everyday work. So Mason, George Mason University College of Public Health is the first college of public health in the Commonwealth of Virginia. We're very proud of that. We're actually completing our accreditation purposes for that accreditation for not just our department being accredited through CEF, the Council of Education for Public Health Accreditation, but in addition to our department, the entire college is going to be accredited as a first college of public health. So what does that practically mean outside of that lovely little title that we have? That means that there are many years of effort of excellence, established excellence that have gone into designing this program, that our programs have been established and noteworthy for being successful, not only in providing education, but in setting our graduates up for success in the field. It also means that we have an incredible interdisciplinary group of faculty, students, and experts in the College of Public Health. So our MPH concentrations have the ability to have our students learning from people who have expertise in different areas. One of the courses that we'll be talking about a little bit, GCH 500, which is the fundamentals of public health, is part of the MPH curriculum, but it's also required to be taken by every master's level student in the entire college. So students in this program are taking most of their courses with other students who are in the MPH program. However, several of them are, or at least in that one course, you'll also be taking that course with students from across the College of Public Health. So you have the opportunity to learn from each other and each other's experiences and expertise. We also have practicum, fieldwork, and internship opportunities. Another thing that makes this program very unique is a lot of MPH programs that are delivered entirely online are very siloed in that people go through those programs kind of as a cohort. So there are students who are online and then students who are in person in the institution. Although this particular concentration is able to be completed entirely online, asynchronous online, we consider students in this concentration just one of our MPH students, which means that you as a student in the online MPH program, public health practice concentration, will have the same access to all of the resources available to all of our MPH students, which means that if you choose to take a course on campus, you have that capacity to do so. If you want to complete internships or function as a graduate assistant, you have the same chance and opportunity to do that as our students in other MPH concentrations. Part of the MPH degree is that end capstone project where you have 200 hours of practicum fieldwork, where you get that tangible in-person experience, but you are also able to leverage that experience to make some connections, hopefully, either to boost your portfolio, to gain additional experience for employment, or to maybe even complete that in another setting that will allow you to get different expertise. So again, with this concentration, students in our program, because they are part of the MPH program, will have all of those fieldwork opportunities that all MPH students have, but they'll also have those other opportunities that are available to all of our MPH students, whether they attend classes remotely or they attend classes in person. The other bit that I would like to mention, and Sarah can chime in if she likes and add more information about this, is our mentor program, which has been very successful in having graduates from our program able to work with, mentor, and share information with current students. Sarah, is there anything you'd like to add about that?
Oh, yes, just a quick note. So usually students who will be like in their second year are paired up with a graduate student from our program. So as Dr. Mitchum said, and this is a opportunity that's usually it's usually done in a semester, but it's an opportunity for upcoming graduating students to be interacting with people who are already in the real world to get a better understanding of what it's like to be working in public health. And it's all optional, but it is a very successful program that we first launched in 2022, and we brought it back 2023, and we are also doing it this year. So we hope to keep that going since it's been a great program.
I love
Thank you
that.
very
I love that. I didn't know about that. So thank you for sharing that.
Thank you. The other things that our students have access to include Sarah, who is absolutely phenomenal and is very willing and available to meet with students. I know she'll share more about that later on. But that tangible ability to be able to connect with somebody and ask questions and have them answered is very helpful. Rise Point also has the capacity for students in this program to have some additional support that will be covered a bit later as well. So again, there are many opportunities for this program to have the support academically, have the support strategically, thinking about the educational process, but also future steps in your profession. Next slide, please. Thank you very much. So our courses, without getting too much into my happy discussions about course design and all of that good stuff, our MPH program has 42 credit hours. These credits are combined with core courses that all of our MPH students have to take, regardless of their concentration. Those include GCH 500 Foundations of Public Health. That's a course to which I referred earlier that is taken by all students in the College of Public Health who are in a graduate program. That's just an introduction to public health, so very helpful to have discussions with students who are in the nursing program or social work, or who are in nutrition or in HAP. So being able to take these courses with other students, but learning about how each different department in the college contributes to the overall field and learning of public health. GCH 604, Fundamentals of Epidemiology and Biostatistics. That is one of the core courses for students who are not pursuing an epidemiological concentration. Community Assessment and Partnerships, that is one of the courses that I teach. So if you take that course, chances are you will see me. And in that course, we explore learning how to understand what the needs of the community are to be able to successfully address those needs. GCH 611, Health Program Planning and Evaluations. GCH 645, US and Global Public Health Systems. HAP 635, Role of Government in Healthcare and Public Health, and then HAP 680, Applied Public Health Leadership and Management. So each of those courses are 3 credits. Each of those are required to be taken by all MPH students. Other courses that are required to be taken by all MPH students are our practicum courses. That is GCH 780 Practicum Seminar. That is a 0 credit course, which means that there are no tuition fees for that course. However, a lot of students go into their practicum opportunity or thinking about their practicum opportunity with a little bit of trepidation, a little bit of fear, not knowing how it's going to work. The reason we have that course is so that by the time you actually get into your practicum and you're doing that work, you have everything that you need in order to be successful. So Dr. Winters, the faculty member who's currently teaching that, and in that course go over some information about how to be successful, how to build your resume, how to network, how to find a placement. And our placements are available not only in person, but there are also some remote opportunities. You don't have to be located right next to Mason in order to complete your practicum. Dr. Winchell will work with you. But again, that practicum seminar is basically designed to make you successful when you take GCH 790, which is the actual practicum in public health. That is 200 hours that are required in person to be able to get that experience. The concentration specific courses, the electives are GCH 551 Rural Health and GCH 560. That one, it says, is not currently available, and there was a question of when it will be available. The answer to that is this summer. So there are 2 restricted electives for this concentration, meaning that you have to have an elective, so you can either pick rural health or environmental health. Rural health was available last semester, and that talks about specific rural health disparities, both here in the United States and overseas. And then environmental health is currently being developed and will be available this upcoming summer. So those are the 2 electives. The other concentration specific courses for this program are Public Health Preparedness and Response, GCH 535, GCH 607, Evidence-Based Public Health Practice, GCH 655, Public Health, Equity, and Justice, GCH 691, Project Management and Public Health, and then GCH 720, Public Health Problems in a Changing Society. And that course is our ILE course, or Integrated Learning Experience, where you will kind of like the capstone course before the practicum, where you take all of the knowledge that you've learned in the entire program, and then you do more of a deep dive into a topic that's of interest to you and explore it in great depth. So that often sets students up for additional success in their practicum. Sarah, is there anything that you would like to add for the courses?
Yes, just a real quick note. So as Dr. Mitchum had this, talked about the practicum, I do want to add that there are a lot of opportunities available within the practicum. So common questions I get are, can it be paid? Can I get paid during the practicum? Absolutely. If that is a site that is willing to compensate you for your hard work, if that's agreed upon beforehand, that's great. Also, there are students who have done practicums abroad as well. Sometimes students are interested in doing practicums outside of where they are. And so, if you find an organization or a practicum site outside of where you are, that's definitely doable. We've also had students do practicums abroad virtually as well. So that can also be explored. So there's a lot of different avenues of how you can complete your practicum outside. So just wanted to add on there.
Thank you very much. Could we please have the next slide? Thank you. So why on earth pursue an MPH degree? The MPH degree is one of the degrees that I think is one of the good things that came out of COVID. Appreciation for having available resources, including toilet paper, understanding how much we value each other, also good things that came out of COVID. But one of the things that made me as a public health professional, I don't want to say excited, but maybe gratified that was a good outcome from COVID, is people know about public health now. They may not have been aware of it prior to COVID, but now there is an awareness of public health, not only its importance and its need, but the value of earning an MPH degree. So this degree is designed to give you practical knowledge and experience, applied experience that can be leveraged for employment in the field. So as part of projected outcomes for employment, public health jobs are expected to increase. The MPH degree is also a nice option for people who have an allied health degree and maybe an undergraduate degree, but then because of accreditation or certification requirements, now a master's degree is required. So for example, nutrition dietetics, it's a very nice complementary degree to be able to add so that you could still maintain your credentialing, get your master's degree, but then also have the extra knowledge and experience of public health. So some of our alums from our program have worked for the CDC, Booz Allen Hamilton, USDA, the Association of State and Territorial Health Officials, and many, 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 many other institutions. As part of our program, we collect data from our graduates, our alums, so that we know what's working great, what needs to be adjusted and improved. So we're constantly in that process of looking at how we can make our program as effective and helpful as possible. So part of that data that we collect are where our alums are employed. And I'm very happy to report, and Sarah can add on to this if she would like, that our alums have very good success at not only finding employment, but finding solid, stable, good paying employment that allows them to leverage their careers. Sarah, is there anything you'd like to add to that?
No, you said it all. Yeah, as Dr. Mitchum said, there's been a lot of students. We hear a lot of feedback. One thing that we do try to do is make sure that we are constantly updating our program and making sure that our information is also updated in order to, understand where our students are going. But yeah.
Thank you very much. Next slide, please. All right, and this is where I'm going to turn this over to Sarah and Chris, if he would be interested in saying anything. So the admissions process, Sarah, if you don't mind.
Yeah, absolutely. So we do have Chris here. So again, if you have any admission questions, please feel free to raise your hand or put it in the Q&A section. It's great because he is somebody that's working in the graduate admissions office. So he's able to answer questions that I might not have answers to. But essentially, so the admission process, so you will be using a portal called Sophis. All of our programs, including the certificate and Masters of Science, also use Sophis as a portal on top of the MPH program. So you would need a bachelor's degree, and a 3.0 GPA is preferred, but it is not required by any means. There will also be transcripts that you have to turn in. You're also required to turn in 2 letters of recommendations. Sophis will ask for 3. We recommend that for the third email address, you can either put your own or a family member's with their consent, of course. Or if you want to add on a third recommendation letter, you're more than welcome to, but we really only look at 2. You will also need a statement of purpose. This is where you will have an opportunity to essentially show the faculty reviewers of who you are and what you're hoping to achieve within the MPH program. So I often tell students that it'll be important to write about why are you applying specifically for the PHP concentration here, and what are you hoping to do with it after you graduate? If you've had any successes or challenges in the past, so maybe you didn't do so great in undergraduate, maybe when you're a sophomore, because you were dealing with some personal things, make sure you write those challenges down, provide examples. It's going to be really important for us to understand what kind of student you'll be here at George Mason. And then you'll also be turning in a resume/cover letter. Chris, is there anything that I am forgetting that students will need to look out for?
No, I think that you encaptured it all. And I think that, one of the common questions that we always get through the admissions process is kind of like, how does my application stand out? And I think that it's laid out really perfectly right here, that it's truly a holistic process, right? So like all of these factors on the screen are going to be factored into consideration when making admissions decisions, and thinking about, great people to recommend you, really kind of highlighting your interests and how the MPH is going to further your career goals, and just highlighting your experiences on your resume. So just making sure that you're following all the outlines, and all of the expectations that are outlined for each of these components of the application process.
Yeah, thank you so much. And I do want to add that specifically for those who are international students, you will have additional materials you do need to provide. So we always encourage you to apply sooner than the deadline, or try to apply as soon as possible, because sometimes it does take time to obtain those materials. So for example, all scripts will have to be translated into English, and then also English proficiency test scores will be required, as well as like a WES evaluation. So again, if you have you are an international student and you have specific questions about like if you qualify, or have any questions of like how to obtain these materials, please feel free to reach out to the Chris in the graduate admissions office.
Thank you very much. I will chime on couple of things here. For the statement of purpose, please do not use ChatGPT to write your admission statement. Have it be coming from you. That's one thing that we've been talking a lot about. So faculty review are the ones who review your applications. And we want to know who you are. We want to know what makes you get up in the morning, what makes you want to be part of a public health career field, what makes you want to earn your MPH. Like Sarah mentioned, if there were things that happen that maybe reflect on your GPA, and like, okay, well, I had an ill family member I needed to take care of, or COVID happened. All of those things are important to include in your statement of purpose, but please have it be in your own words. We want to hear your authentic voice. We don't want to hear an inauthentic voice that is not you. The other thing too is to keep in mind that we have 2 admission cycles for the public health practice concentration, the online MPH degree. So for the spring admission, for this upcoming academic, or this upcoming semester, that would be December 1st. So please make sure that you start the process, if you're wanting to pursue this, as soon as possible, so that all of your documents can be in by that deadline, so that we can have time to review it before the holiday break. Any questions at this point? I see some questions in the chat box. Are there any evaluation classes we can add to the community health consideration? So I'm not really sure what's being asked there. If you want to add a clarification, that may be helpful, but I can speak to evaluation components in classes. So most of our courses are designed to expand on evaluating systems, evaluating projects, evaluating policies. So in thinking about community health or global health or anything like that, it's there are those evaluation components that are part of the courses. If you have a specific focus that you're looking for that was not answered by that, please definitely clarify. If a school is taking too long to get this transcript to you, is there a way to contact them? Sarah's typing an answer, but if Sarah wants to give the answer.
Oh, yes. And Chris, feel free to chime in here. But I think so. Typically, you will be, because you're applying through Sophus, you will be putting your transcript through Sophus. And so if you are unaware of like the status of where your transcript is, please contact Sophus first. There's usually like a Sophus customer service contact, and you can always ask them to see like, oh, was my transcript delivered? It'll usually show up in the portal as well. Sometimes students do send it to George Mason University, but we ask that you send it to Sophus since that is the portal you're applying to. And if your school is taking too long, maybe try to contact them again or, send them an email, give them a phone call. Chris, is there anything else that the student should be doing?
Yeah, I completely echo what Sarah mentioned that you first want to check in with Sophus. But if there is a glitch going on and that, you're not hearing any responses, we always encourage you. It doesn't hurt to send out to, either call the school or to send an email to the school just to kind of check in and say, hey, I requested my transcript at this date. It's kind of been a little long. I'm just kind of checking in and wanting to inquire about the process. So it doesn't hurt to follow up with them.
Thank you. And then in terms of the recommendation letter, so we do ask that it is usually someone that can speak to your academic performance, whether that is a past professor, maybe they might not have been directly associated with your classes, but maybe you worked with them on a research project or someone that can talk to your academic performance. And it can be from someone from your previous university. So that's completely fine, but we do ask for that. Worst case, if you've maybe a supervisor from a job that can talk about your character and your work ethic, that is okay too. But we do ask that we usually have someone that can speak to your academic performance write you at least one letter.
Thank you. And there's also a question about why is it difficult to apply through Sophus? I would say that in any application process I have ever been involved, it's always been somewhat complicated. Sophus is kind of the gold standard for many public health programs. And as part of that accreditation process and making sure that everything is done as excellently and holistically as possible, Sophus is one of those platforms that allows us to do that. So if you pursue applying through Sophus, good news is you do have support. Chris and his amazing team are there to help. Also, RisePoint has a lot of staff who are able to support and assist you too. So even if it is challenging, you will not be going through the process alone. All right. Next slide, please.
I was gonna say, we're actually at question and answer, but you segued really well. That's kind of where we step in and help you with the application. There's only so much we can do because it is your personal information, but you do have us as admission representatives on your side, supporting you through each step of the way. I work with students, and honestly, I'm your cheerleader. I'm your supporter. When you go through a step, I'm right there. I'm proud of you. I'm celebrating with you. Sophus is, I work with a lot of different programs. Sophus is a little bit harder because I honestly can't see it on my end. I have a coworker that one of our team members that does, and he's very quick to get back to us when I'm asking questions for students in the MPH program. But it's doing it one step at a time. But I can understand that question as someone new to this role. I'm learning Sophus as well. But Dr. Mitchum is exactly right. It is what is used, and we just do it one step at a time, right?
There's a question in the Q&A box. Do you have any recommendation form? To the best of my knowledge, that is just something that you can have your the person who's writing you a referral write. One thing that I've done when I've had students ask me to write a letter of recommendation is I've asked them to provide me with some of their strengths or some of their CV or their resume. So that way I have what I know from having taught them in the classroom, but I also get a better picture of their background so that when I write my letter of recommendation, then I have a little bit more information just outside of their classroom performance. So that is also very helpful. Also making sure that you think creatively about people that have been in your teaching history. So if it's been a few years, maybe reaching out to a faculty member and starting a conversation before, hey, I haven't seen you in 5 years, but write this letter for me. Maybe introduce like, thank you, doctor or professor, whomever. I was in your class during this semester. This was the class that I attended with you. I'm looking to pursue my MPH degree. So having that tangible touch point with the faculty member and reminding them who you are is also very helpful. Are there any additional questions that have not been asked yet?
Yeah.
So I'm going to put,
Oh,
go ahead.
sorry. There's another question in the Q&A chat, actually. It says, I saw that we need to submit a resume, and is that through Sophos as well? So yes, all application materials need to be uploaded on Sophos.
Then I just put my email address into the chat. If anyone has any specific questions, I know sometimes people don't like to ask questions during these sessions, but if you have any questions and you would like to ask them afterwards, if you'd like to set up a meeting via Teams or Zoom to talk about the program, I'm always happy to answer any additional questions that may not have been answered tonight or to talk more about our program.
Yeah, this is a great time if you have anything. We have our experts here. I love these sessions because I get to learn even more about the programs, and I love hearing from y'all. So thank you so much for your time. We just had a question. Will we please be able to send the recording? We actually will have it posted. I'm not sure exactly how quickly they go out there on the website, but I can send you a link once it gets posted. Our one from the that was run for this fall is out there right now. Very similar information, very similar format, but the new one will be posted shortly. But I can let you know definitely. That's a great question. And if anybody doesn't have any more questions, one last time while we have our experts. Oh, we got one. Would it be acceptable for a coworker to write a letter of recommendation is the question that just came in.
Dr. Mitchum, as someone who does usually review applications, do you have an answer for this?
Excellent question. And thank you, Sarah, for deferring it to me. My strong recommendation would be no. That if you do not have any faculty members who could write you a letter of recommendation, it looks much better for us reviewing your application if it's somebody who's in a position of authority over you, either a supervisor, if you've done an internship, a preceptor, faculty member, somebody who can speak to your ability with a level of authority that may not be on a friend or a colleague. So if you do submit a letter of recommendation from a coworker, it will not be rejected, but your application will be much stronger if that letter of recommendation can come from somebody who has been either a teacher, a faculty member, or a supervisor.
Any more questions? I just personally want to thank each and every one of you, Sarah, Chris, and Dr. Mitchum. I really want to thank each of you for taking your time to be here with us. We do have one more question that came in. If I have a bachelor's degree unrelated to public health, can I still apply for the public health master's?
Absolutely. So we have many students who are in their MPH program who have different undergraduate degrees. I mentioned earlier nutrition, and the reason I know about that is I have worked with a number of dietetic nutritionists who are working on their MPH degree because they need that master's level accreditation. We have some students who have had educational backgrounds, some who have science backgrounds. People come from all different academic journeys. There are a lot of students who go through their undergraduate degree, get some life experience, and then realize that they love public health and want to get that degree. So the very long answer is no, you do not have to have a public health undergraduate degree. The requirements that we outlined earlier that Sarah and Chris discussed are the requirements that we have for admissions into the program. And the person does not have to be from the United States for a recommendation. Again, we're looking for a faculty member or a supervisor with not only experience with you, but ideally experience to be able to speaking of how you would do in this program. So if your supervisor has public health experience and you've worked in that field, or if your supervisor has seen you in any health related setting, then that would be acceptable. But no, they do not have to be from the United States. And what if the practicum is a remote job? So again, as Sarah mentioned earlier, the practicum component, the 200 hours of required experience, can be completed remotely. We have had students do that before, but the specific requirements and instances of that in order to meet our accreditation requirements so that your degree is valid will be worked out with Dr. Winters. So it can be completed remotely, but it can't just be at any remote site. There are very specific requirements that will be put into place. But Dr. Winter is fabulous. And once you get through the program and get to that stage, she will work with you to make sure you find that placement.
Yes, I do want to add real quick that that what students are not able to do their practicum at their current job. So if your job is currently remote and maybe somewhat even related to public health, it cannot be your current job. So it can't be your current job title. It could be at the same site. So maybe your work has multiple departments and there's someone that can supervise you. So it needs to be a different supervisor and a different job title. But again, as Dr. Mitchum said, the nitty gritty of where your practicum placement will be and all the questions that you may have can be answered by Dr. Winter, who is a practicum coordinator, once you get admitted into the program. And again, the prep course is there, so you're not just thrown into a 200-hour practicum or internship. So you will be prepared before you go into that.
And piggybacking on that, there are several students who start their MPH journey and have so many questions about the practicum that they want to have all of the answers right then. And Dr. Winter would tell you, wait, learn first, take a few courses. And then when we get closer to the practicum, we can work all of that out. And the reason for that recommendation is there's so much content, information, practical skill set information that needs to be learned and developed first that will then frame the practicum experience. So all of that to say, we'll definitely work with you, Dr. Winters, absolutely fabulous. We've had students be able to successfully complete their practicum in a variety of different settings, but it's not something that you would need to necessarily be so focused on now. It's something that can wait a little bit too.
That's great information. Does anybody else have any other questions? Y'all are coming up with some wonderful questions. I don't want to let them go if you still have one or two out there, but I do want to let them get back to their evening as well. And if you do have any questions that come up, feel free. I know Sarah provided her information. I believe Chris provided his. We have our general email listed on here, our phone number. If you do have an admissions representative that you have been working with, I encourage you to reach out to them with any questions. They will more than likely be reaching out to you in the next day or two if they see that you are on this webinar, just to check in with you. But feel free to email or call, and we will be able to to get back in touch with you, or get you in touch with an admissions representative if you don't have one that you're working with. But we are so, so thankful you joined us tonight. Like I said, these are my favorite nights, getting to learn more and get to interact with each and every one of you. Um, and I want to just thank all of our panelists for hopping on tonight and thank our guests as well. And thank you so much for joining us. Any other comments or anything from our panelists? Well, thank you so, so, so much. And everybody have a great night. And we hope to hear from you soon.
Good night, everyone. Thank you for joining.
Good night.
Thank you.
Bye, everyone. Thanks for coming.